Hi, my name's Erica McKnight. I'm a registered nurse at the Mercy Orthopedic Hospital in Ozark. I work as a circulator in the operating room. I've been there for 1 year. I graduated the ASM program at SBU last May, and I started in the recovery room and the pre-post area at the ortho hospital, and then just within the last 5 months, I've transferred to the operating room, which I love. So I'm married. My husband and we've been married for 3 years this summer, and we have an 18-month-old. Um, Hobbies, um, I would say shopping, spending time with my family, and I like to do anything outdoors, hunting and fishing and things like that. So, let's see here. I've been in healthcare for almost 5 years. When I started nursing school, I had been working as a PCA at Mercy at the main hospital on the orthopedic med-surg floor. And then once I graduated, I moved to the orthopedic hospital. One thing I love most about technology is how readily available it is. Pretty much anywhere you go, there's some form of technology that you can use, and people are constantly on their phones, and you can take your laptop with you anywhere. So it's nice to have the easy access. Things that I don't like about it is that it's constantly changing, just like anything else, and I don't really like change. So, one thing I hope to learn from this course is just how informatics works. I would say more in healthcare. I didn't know exactly what informatics meant to begin with before we started this course, and how it all entitled into healthcare in general. So I just hope to learn more about that. Let's see here. I plan on implementing, anything that I learn in this course in my job. We've recently, at the orthopedic hospital, I think it's been 7 or 8 months since we've started this, but they started a new charging system in the operating room for implants and all of the supplies that are used in all the cases. And the orthopedic hospitals became kind of the trial center for this program. And it uses a computer and a scanning system and all of that. So I think that'll kind of help me just understand better why they do this, to make it easier for the people that work in the operating room, and how it can, be more efficient in the charging for all these things that they use in all the cases. So, experience that I've had with informatics now, I would say, is probably using the electronic health record in Epic. We use that constantly for every case, and as a PCA, I used it in charting for all of my patients. So, my most memorable learning experience, I would say that would be probably clinical for when we were in nursing school during the ASM program. I felt like getting hands-on training with real patients in a real setting was the best way for me to learn. I think that would be my most memorable learning experience, and I felt like it definitely made a huge impact on my nursing career, learning, the basics to nursing right offhand. I think that my greatest challenge in this course would probably be just having an open mind to learning about this. It's not necessarily my most favorite subject, but it'll be a challenge just to learn about it all, and I think just keeping complete interest, just to be honest. I know it'll be beneficial in the long run. So I think that's all I have. Thanks.